Welcome to today's episode of Rural Health Pulse. I'm your host, Dr. Jim Kinnear. In today's episode, we are discussing the topic of rural population decline and exploring how it intersects with rural health issues. Our guest is Indiana County Commissioner Sherene Hess. Welcome, Sherene.
Thank you. Great to be here.
To begin, would you mind introducing yourself to our listeners and share how long you've been a county commissioner and a little bit about what that role entails?
Sure thing. So I'm Sherene Hess, and I'm in my third term as a county commissioner. And before that, I worked in the environmental conservation field with agriculture and clean water and soil health and clean air and things of that nature. And I still continue to do a lot of those kinds of things in my commissioner role. But now I'm in a role where county government delivers myriad services related to the courts and correction system, public safety, community planning, elections, health and welfare of children and seniors and veterans and many things like that. So I've lived in Indiana for a little over 30 years. And I'm in my 10th year as a commissioner.
Thanks for sharing that. And it's amazing just to think of the multitude of things that a county commissioner is involved in.
Yeah, it sure is. I never realized it, even though I'd worked with county government in my previous jobs. They just cover a lot of territory.
You recently spoke before the Pennsylvania Rural Population Revitalization Commission. Can you share a little bit of information about that commission and the comments you made before them?
Sure. So the commission was created last year by the legislature via Act 21, and the aim of it is to examine the challenges that are facing our rural communities, especially population decline. And mostly in western Pennsylvania, we are experiencing this decline in population. Most counties, if not all of them, are expected to have a decline in their population over the next 30 to 40 years. Now, interestingly, Indiana County is expected to have a bit of an incline, or an increase in their population, and which is a good thing, but we're not quite sure how that's going to play out in terms of the dynamic there. Does that increase in population mean that there are going to be more expenses associated with that, or is that going to bring a number of economic things that are on the positive side? So we'll see on that. But anyway, this commission is really aimed at getting recommendations on how to attract new residents and retain the ones that are there. So they are looking at legislation or regulatory changes or just any number of ideas related to that. And my comments were really related to how does it affect county government and those services that I mentioned earlier on how we deliver them.
What do you think are some of the major factors that contribute to that overall decline in population in rural communities?
Yeah, we've been experiencing this now for about 5 decades. And, you hear about the Rust Belt, and that's what Indiana County is really part of. And that really refers to the deindustrialization of the cities and the towns and the rural areas that we've seen over these number of decades. We watched our steel mills close in our region, and then Indiana County is famous for its production of coal, so a lot of the coal mines closed over those decades. And basically a lot of this was due to technological changes, to trade deals at the national level, to increase competition, global competition, and also the regulations related to clean air, clean water, clean soil, that kind of thing. So we've watched this deindustrialization happen, and with the closure of those facilities, a big loss of jobs, and we've watched unemployment be in double digits now for many, many years. And so when you don't have the jobs, people are going to have to look elsewhere, and that's what happened.
As we think about that declining population, what are some of the stressors or impacts, the negative impacts of a declining population in a rural community?
When you have people leaving, that decline in population means a decline in tax base. And from a county perspective, and even a school district perspective, you're looking at having to maintain services a lot of the time, the same kind of level of services, but with fewer resources. So that is a difficulty. And then you have a loss of workforce. So you have businesses who now are struggling to find bodies to fill those jobs, and you have a loss of a skilled workforce, and that's really happened. Took a major toll on places like Indiana County. So those are two stressors, and then you have an aging population that kind of, when you have young people leaving, that population becomes and one that's aged, and there are all sorts of challenges that go along with that.
Those are some great examples, and can just see how that tax base issue can occur at a couple different levels. There's less employers and businesses paying taxes. There's less workers that are paying taxes, and less homeowners that are also paying taxes. So it really has a ripple effect through various areas of the economy in terms of the overall impact.
It does. It does. It becomes harder and harder to deliver those services in an efficient way. And, really at the county level, we're limited in the ways we can get revenue. We have taxation from property assessment, and that's okay. And we have fees for services, and there are grants. There are federal funding, state funding, and some intergovernmental kinds of arrangements that help bring some revenue in. But when you don't have that revenue from within, you're just faced with so many challenges and how you're going to do that because the last thing you want to do is increase taxes.
And as you pointed out, while the population might be going down, you still have the same infrastructure to maintain. You still have the same number of roads and utilities and other public infrastructure that needs to be in place, but you just have less resources to manage that.
You do. That's exactly right. And not only do you have to maintain infrastructure and those kinds of things, but you have things happen in a community that's in decline, like our opioid crisis, and that happened. I'm glad to say that we're, for various reasons, things are looking a little better in that department, but only because we've invested millions and millions of dollars into treatment, prevention, education around that. But that's just an example of what can happen to communities when you have that void. Things happen, and then you have even more services that you need to provide as those revenues are still decreasing.
And that's a great segue into an area that I wanted to explore is, what is the impact of the declining population in some of the areas of rural health? And so you mentioned a great example there with the opioid crisis, that if communities are declining, we may see an increase in the use of drugs, and that has obviously societal impacts and definitely has an impact on the health of the community. Are there any other areas where you see the declining population also creating other rural health issues or challenges?
Well, we have seen a lot of mental health challenges for every age group, really. And that's what's been a real challenge for a lot of the mental health and substance use disorder services are provided at the county level. They are really county-based, community-based services, and when that funding from the state really took a hit some years ago, and we've never really fully recovered from that. We've become very adept and agile at finding some other revenue sources. We have a wonderful behavioral health and development program at the county level, and a drug and alcohol commission that really works hard at being very creative on how they can deliver the services that are needed. And then there is the opioid settlement dollars that came in from a class action lawsuit that really is a boost to counties. Those dollars are significant. They're never going to cover the full cost, but they are a significant thing that's happening now, and we are partnering at the county level with IRMC to have a mobile unit that can go out to communities and go to where people are to help them with these services. And we're talking about not just treatment for the substance use issues, but all sorts of wraparound services like where to get housing, where to get food, where to get employment, and all those things that really are just basic human needs. There's a lot of need out there. But I feel very optimistic that Indiana County's got a lot of leadership in this area, and we are using some very innovative ways of solving these problems.
Those are interesting examples, and as you think about some of those issues, such as housing and access to food, we're really getting into what's often referred to as the social determinants of health, that we realize that all of these factors play a role in a person's ability to be a consumer of healthcare and to maintain their own health as well. And I was also just thinking earlier, you mentioned about the aging population that, as population declines, often it's younger individuals that are leaving the community, but older individuals may be staying in the community. And I can imagine that's a challenge as well, as the county needs to provide services for that aging population, and again, has less resources in order to do that.
Yeah, we have a terrific aging services organization. Every county has one, and we are very fortunate to have a really well-appointed organization there. It's got a great board of directors and a number of services. We have a number of the social centers around the county, and that's so important because isolation is often very much a contributing factor to poor health in our seniors. And so there are these opportunities for them to gather at the social centers. And then there are a number of social workers involved in our aging services organization that are there to, if there's some issues, some neglect, some memory issues, those kinds of things that our seniors experience, there are some social workers there that can connect them to the services they need. So we're very fortunate in that way now, and funding is always an issue there too. And I know that they work hard every year to make sure that, the state budget is adequate for the needs, and as you say, those needs continue to grow. But again, there's some innovation and some leadership coming into play with here that they're doing some classes on how to be connected to the internet and how to use that for telehealth, for commercial purposes of purchasing products, for connecting with their loved ones. So we're kind of on the tip of a lot of really innovative things. But again, we need to continue to invest in those and not pull back. And that's the challenge.
You mentioned some really great examples there. Any other initiatives happening here in Indiana County to address either the challenges of population decline or rural health that you'd like to highlight?
One thing that we learned from the United Way's ALICE study, and that ALICE stands for Asset Limited Income Constrained but Employed, that population is really significant in a county like Indiana. And what it means is, you have folks who do live below the federal poverty line, and they have a lot of services that are available to them. It's sometimes access is a thing, but you have this other huge portion of the county who are the working poor, and it's a struggle to help them move forward. So one thing we always keep in the back of our minds is that's nearly half of our county population. So at the county level, we work with our economic development partners almost daily to try to figure out, okay, what do the new jobs, of the coming years look like? How do we attract more business, industry? Light industry is really something that works well in a region like ours. We've had a number of things happen in that regard, but it's like you can't rest on your laurels once you bring something new in. You always have to be constantly looking at what's in the future. And then, the energy industry is changing, and Indiana County is a leader in energy. And now we're going to see what happens at the Homer City redevelopment operations, what's going to happen with that huge asset at the power plant, or where the power plant was. How many jobs, what kind of new ancillary businesses might result. So it's an interesting time in Indiana County's history. But again, I feel optimistic that there are things on the horizon. But in the meantime, at the county level, we need to, as we said, continue to deliver the services and the programs that are going to keep people stable and hopefully keep them here, as well as bring in new people.
I can imagine this would be difficult because there's so many important and valuable things that need to be done. But if you could wave a magic wand and open up funding resources for one specific project or initiative, is there one that you would most like to see advanced?
Well, I'll begin with two things that are happening that are very positive news in the rural healthcare arena, and that's the IUP's College of Osteopathic Medicine that's been proposed, and they're working very hard at that. That is a great thing. Talking about physicians that will hopefully be trained here and remain in rural areas. And then the IRMC's behavioral health facility that's coming online very soon. These are two areas that are just so vital right now for an area like Indiana County. But what I think I would love to see, and I know there are groups working on it, is a real hard look at how do we help people focus on nutrition and food security and how to prepare food and even exercise and those kinds of things that can, going back to you talk about the social determinants of health, how we can give folks agency over their lives and what they can do to make their own health, be a protector of their own health. We know there are going to be physical needs and mental health needs and those kinds of things, but my hope is, and I know there are some folks working on it, that we have that infrastructure for people to like a food hub is the thing I keep hearing about. So looking forward to some interesting things happening there.
Food insecurity certainly is an important topic, and we may have had conversations with similar people, and just the last week had some conversations with individuals about some initiatives around food as medicine, and I agree. I think that's a really interesting area, and I think Indiana County has a lot of potential and opportunity to make that a key strength in our community.
Well, I would agree. And, I know there are teaching kitchens right now happening in various agencies, and I know IUP has a terrific nutrition program. And we have the Indiana County Conservation District who is working on these matters that are related to food and the healthful aspects of food and growing local food and consuming local food. We have a number of federal programs that are aimed at helping farmers actually have a way for them to deliver food locally grown into the schools, which is a difficult, kind of a complex task. But here we have some federal funding that hopefully can help with that. We'll see what the future brings for that. But yes, there are so many neat things happening. There's a lot of leadership in this area in Indiana County.
Is there anything else that we've not had an opportunity to discuss that you would like to share with our listeners?
Yeah, we have focused at the county a lot on broadband and getting broadband resources out to the rural areas. We know how important it is to be connected, and that's one thing we've put together at the county level with our partners about a $7 million project, which is being deployed now. And we know that people are getting internet that they never had, or very poor internet before. So we know that that's going to be important for them to connect with each other, to employ telehealth resources, to learn to just, avail themselves of all the things that the rest of the world can offer. So that is one thing I wanted to mention. And again, the county's always trying to partner with all the various agencies and nonprofits in our area to bring about innovation. We know it's out there, and there's some exciting times, I think, in front of us. So looking forward to it.
Thanks for sharing those examples. And certainly broadband is really critical to, as you mentioned, the delivery of telehealth, and that's really critical to ensure people have access to services that they might not otherwise be able to get to because of transportation barriers or other types of issues as well. And it's just exciting to know there's so much good things happening in Indiana County, and we really appreciate the work that you and the other commissioners do to help to continue to advance that. Thanks for spending some time with us today, and thanks for being part of Rural Health Pulse.
It's been my pleasure. Thank you.
Rural population decline poses significant challenges to rural health, as fewer residents often mean reduced access to healthcare services and strained resources. As the population ages and economic opportunities dwindle, rural communities face heightened risk of health disparities, including higher rates of chronic diseases and limited mental health support. Addressing these issues requires innovative solutions to ensure access to care, economic revitalization, and community well-being. Rural Health Pulse is a collaborative effort of Indiana University of Pennsylvania, Indiana Regional Medical Center, and the Indiana community. It is produced by Chris Korn from the IUP Division of University Advancement and recorded by the IUP Communications Media Department. I'm Dr. Jim Kinnear. Thank you for listening, and be sure to watch for future episodes of Rural Health Pulse.